Yes, we do, Madam Chair.
Okay. Well, is everybody ready for us to start the meeting?
I think I am.
Okay, well then.
I think I'd like to just pull off that item L off the consent calendar if I can. I'm not sure that I fully caught what
If you can hold for a moment, Commissioner,
Yeah.
if you can hold for a minute,
Sure.
I'm gaveling us into the public meeting.
I'll do that. Yeah.
Okay, so welcome everyone to the December 1st, 2020 Board of Commissioners meeting. Board Clerk, Mr. Moss.
Yes, thank you, Madam Chair. The Board of Washington County Board of Commissioners, also meeting as the Clean Water Services Board of Directors and all other service districts, is now meeting in regular session this December 1st, 2020. Commissioner Rogers.
Here.
Commissioner Treese.
Here.
Vice Chair Scouten.
Here.
Chair Harrington.
Here.
I will announce that Commissioner Willie is excused from today's meeting.
Thank you. Before we dive into the agenda items, we have a number of changes from when the agenda was first published. So under item number 5, public hearings, Clean Water Services, we have a revised item A on the rates and charges for clean water services. Then there are a number of changes under the action section. We will continue to have item A under clean water services. Item B is an added item related to the emergency declaration and expanding authority delegated to the county administrative officer. And we now have 4 items that are being pulled from the consent agenda and moved to the action agenda. The first one, item C, will be what had been item A on the consent agenda to approve the goal sharing award for continuity and operations under emergency conditions. Then under the support section, Commissioner Scouten was just asking, as we were gaveling in, to have item L, adopting the annual investment policy, pulled. That will be item F. Sorry, I'm following it through the consent agenda. Then items Q and R are moving off of the consent agenda and moving under the action item as well. So that will leave us with item C as the goal share, item D as previously item Q, item E as previously item R, and item F as previously item L. Is that okay with everyone?
Thank you.
Okay. Alrighty. So first item on our agenda is oral communication. Mr. Moss, do we have anyone signed up for today?
Yes, we do, Madam Chair. We have 2 people signed up. The first one is Mr. Dale Feek. Dale, can you hear us? Dale, are you there? You signed in twice.
Dale,
let me see if this one is.
Can you hear us?
Dale, you are muted. Can you hear us? All right, Dale, we'll try to get you on at the end of the meeting. If you just stay on, try to work that out. Next, Madam Chair, we have Jim Long.
Jim, can you hear us?
Can you hear us, Jim? You are muted right now.
Yes, I can
Right.
hear you.
You're breaking up a little bit, Jim.
I don't know what I can do about that. Should I just, is it time for me to start
You hear
talking?
us?
Yes. Good morning, commissioners.
Mr. Long is
hope you-
having some tech, so we try to work on this.
Good morning, commissioners.
So-
I hope you have a happy December. After Thanksgiving, CPO4M received by mail the draft habitat assessment guidelines from long-range planning staff at LUT. CPO4M requests a 30-day or 45-day review period for the habitat assessment guidelines and an opportunity to make public comments before both the Planning Commission and the Board of Commissioners. The habitat assessment guidelines appear to be inadequate in both definitions and omissions. We have not had time to confer or get input from wildlife biologists, botanists, or ecologists. Thank you for considering this request.
Thank you, Mr. Long. Mr. Fee, can you hear us now?
I can. Can you hear me, Kevin?
Yes, we can. Please go ahead for up to 2 minutes.
Thank you very much. I'm turning my volume up. I may have to do that. Chair and spokesperson for Washington County Citizen Action Network, Chair Harrington, and other commissioners. I have 2 public comments during this 2-minute time. One has to do with the decision made at our meeting last night.
Dale, can you hear us? You broke up.
Washington County Citizen Action Network, and the other has to do with climate CCN. I can hear you. Can you hear me? Oh.
Yes, we
Can you
can.
hear? Okay, can I start? I don't know. Should I start over?
Please do.
Thank you. Spokesperson for Washington County Citizen Action Network, Chair Harrington, and commissioners. I have 2 comments during this 2-minute comment period. One has to do with the decision that WCCAN made last night at our board meeting. The other has to do with climate change and investments. First, WCCAN. At the WCCAN board unanimously last night approved a motion to request a 30 or 45-day review period for the SNR habitat assessment guidelines. That's our do with an item that you discussed during your work session today. It has to do with financial investment.
I'm sorry, Dale. We just
What
can't.
you are doing to be more proactive. Oh, really? You're not hearing me?
No.
All right, can I do it let me at the end of the meeting then? I'll use a different system. I don't know what's going on.
All right, we will save you for the end of the meeting, Dale. Thank you for trying to hang on with us.
Thank you. All
right, Madam Chair.
All right,
Yeah.
thank you, Mr.
No,
Moss.
signed up.
Okay, so we'll move on to our consent agenda. The consent agenda today consists of 13 items. Minutes from the November 17th meeting. 1 item under Clean Water Services, that's item B. 6 items under Land Use and Transportation. 1 item under Health and Human Services. 4 items under Support Services. That's item K, excuse me, item J, item K, item L, and item N. Hang on, I missed 2 more, as well as item O and item P. So that would be 6 in total under Support Services. What are the wishes of the board with regard to this revised consent agenda?
Move for approval of the revised consent agenda.
Second.
We have a motion and a second to approve today's revised consent agenda. All those in favor, please vote by saying aye.
Aye.
Any opposed? The motion carries unanimously 4-0. Thank you. The next item on the agenda is a proclamation to proclaim World AIDS Day in Washington County. Mr. Moss, do we have a staff presentation?
We do, Madam Chair. We have Aaron Parrish, who should be on the screen to provide this PowerPoint for you.
Go ahead, Aaron.
Thank you. Sorry. My name is Erin Parrish. I'm a senior program coordinator with Washington County Public Health in the HIV program. Next slide. So the theme of this year's World AIDS Day is global solidarity and shared responsibility. This theme really represents the importance of working with our community partners to serve the larger community in eliminating the stigma and discrimination associated with HIV and STIs. We also have seen within the COVID pandemic that working within in creating partnerships has really become even more important than ever before. Next slide. So I wanted to show some of the local data. This is from last 2019. This data really highlights the disparities that we continue to see among those newly infected with HIV. Of particular importance that I wanted to point out is the continuing disparity among men who have sex with men, including those who do not identify within the LGBTQ population. Also, the increasing disparity that we're seeing among the Latino and Hispanic community. 38% of our newly diagnosed infections in 2019 were among those who identify as Latino and Hispanic, as well as an increasing disparity among people who identify as having used drugs. 19% of our new infections were in those populations. So some of the programs I'm going to highlight today will show you the work that we're trying to do to work on those disparities that we're seeing. Next slide. So now I'm going to talk about some of the steps that we're taking. Next slide. So of particular importance, and we're really excited to share this program, our syringe exchange is new to Washington County. This started in October of 2019. So we just finished our first year. We've been partnering with the HIV Alliance, which is an organization that works across Oregon to provide HIV testing and education and prevention programs, as well as harm reduction services like syringe exchange. We've also really been working hard to work with street outreach teams and those organizations that are working in day centers and serving our houseless populations that can be harder to reach, including Project Homeless Connect. This has been a particular importance and really helped during the COVID pandemic when expanding our services has been challenging. We currently are operating a mobile exchange in Hillsborough with the hopes that we will expand that to additional sites once we're able to do that in light of COVID. But I did want to point out in our first year that we have been able to serve approximately 500 clients. We collected approximately 42,000 syringes and were able to distribute over 700 doses of naloxone. And for those not familiar, naloxone is a drug, a medical drug that will reduce or will reverse the overdose from opiate use. Next slide. I also wanted to talk about the testing that we continue to do in the community. Even during COVID, we've been able to keep a lot of our testing that really highlights and targets those at highest risk for HIV infection. So that includes those communities that I highlighted earlier. So we work with the Cascade AIDS Project to offer high-risk testing sites at 2 clinic sites in Washington County. And we work with different community partners to do community-based testing as much as we can. A lot of that has, again, changed because of COVID, but we will get back to providing those services as much as possible. We also really work hard to bring in staff and work with organizations that can serve the population that we're seeing. So we really focus on hiring bilingual and bicultural staff. Next slide, please. And our final partnership that I wanted to highlight that I'm very excited about is one that we've started with Familias Nación. They are an organization that has become a real leader in serving the Latinx community in our Tri-County region. And we're working with them to develop a curriculum that will train local community health workers and health educators from the Tri-County area and from Washington County to provide culturally competent, non-judgmental and non-stigmatizing sexual health education and referrals for getting tested for HIV and sexually transmitted infections. And so this curriculum is developed, and they are working now on a plan to get this training out in a virtual format, as well as, when we're able to come back together in person and work with our partners, do that in person, and then get this education and information out to those community health workers who will then work with their clients and be able to provide this, this education and hopefully reduce some of the stigma associated with sexual health. And next slide. And finally, we are continuing to work on coalition building. Building coalitions and working with our community partners is a huge part of the work that we can do to build up our program, provide technical assistance to community partners, and create a community within the different community partners that can really work together to create different programming. So one of those planned coalitions is our Harm Reduction Coalition. This will be a part of the Community Health Improvement Project. And we plan to partner with coalitions that are already existing that have similar missions, like the Reproductive Health Coalition. And then we're also working with partners in Multnomah and Clackamas counties to form a Latinx coalition. And this coalition will really focus on serving the Latinx population, bringing together community partners that may not have thought about doing sexual health education work, and that might be able to provide other types of health education and health services. So we're really excited about these two. Again, with COVID, these might take a little bit longer to get going than we had initially planned, but we're still really excited to continue the work that we have for forming community partnerships. Next slide. And then this is my contact information, and any questions or comments about our programs can be directed.
Commissioners, do you have any questions for Ms. Parrish today?
The only comment I make is I deeply appreciate the work that she's doing and its importance and its sensitivity. So I thank you, Erin.
Thank you.
My hat is off as well. Thank you very much.
So, Mr. Moss, I'm not sure if you're going to be reading today's proclamation or if Erin will be doing us the honors.
I certainly can read it for you, Commissioners. 1 second here. A proclamation, Board of County Commissioners for Washington County, World AIDS Day, December 1st, 2020. Whereas in the United States, approximately 1.2 million people are living with HIV, and it is estimated that 1 in 7 of those individuals are unaware of their status. And whereas in Washington County, we continue to see the number of new infections rise, particularly among the most historically underserved by the medical community. And whereas the issue of stigma around sexual health and testing for HIV and sexually transmitted infections continues to impact our ability to bring down the rates of new infections. And whereas the stigma and discrimination that comes with it has disproportionately impact on communities of color, those who face drug addiction, and the LGBTQ community. Stigma can also cause isolation, which affects older individuals who make up approximately half of those living with HIV in Washington County. And whereas the need for county community-based organizations and healthcare providers to partner on prevention, testing, and treatment solutions is greater than ever, this is echoed in the 2020 World AIDS Day theme, Global Solidarity, Shared Responsibility. And whereas the Washington County HIV STI program is collaborating with community partners that have built the trust of community to break down barriers associated with stigma and shared messages of prevention and the importance of getting tested. And whereas staff within the ever-changing world of COVID-19 pandemic to continue providing access to HIV STI testing through the Washington County High-Risk Clinic and community providers, as well as educating clients about evidence-based prevention services like pre-exposure, prophylaxis, and syringe exchange. Now, therefore, it be resolved that on this first day of December 2020, the Washington County Board of Commissioners, in their role as the Board of Health, does hereby proclaim December 1st World AIDS Day in Washington County and encourages Washington County residents to help reduce the impact stigma plays in HIV epidemic by talking to their friends about knowing their status. Signed this day by Chair Catherine Harrington and the recording secretary.
Commissioners, do we have a motion to adopt this proclamation?
So moved.
Is there
Second.
a second? We have a motion and a second to adopt this proclamation proclaiming December 1, 2020 as World AIDS Day in Washington County. All those in favor, please vote by saying aye. Aye.
Aye.
Any opposed? The motion carries unanimously 4-0. Thank you. And thank you, Ms. Parrish, for the work that you and your team do each and every day to help ensure the safety of everyone in our community.
Thank you.
Next, we'll move on to a presentation. And I know this is going to be a real information-filled one today from Marnie Kyle, our Director of Health and Human Services, to give us an update on where community spread of this new coronavirus that we refer to as COVID-19 stands in our community, and a bit about the new state metrics. Take it away, Ms. Kyle.
Okay, good morning, Chair Harrington and board. I also want to say, just so that we can get it lined up, that Tricia Tillman is going to be joining me when we talk about some of the work that County Administrative Office and Community Engagement and Office of Diversity and Engagement are joining us in. So just so that we are sure to get her set up. It always scares me when all of a sudden it says you're rejoining, and I think, oh no, I lost it right when I'm right when it's my turn, but it always works. So yeah, so anyway, we can go to the next slide. So we'll start as normal with the numbers, and you can see because I sent you all a slide the day before Thanksgiving that was very similar, a slide deck. So you may notice just even in those few days that the numbers have gone up pretty significantly. As of yesterday, Oregon's had over 75,000 cases. The statewide case rate has jumped up to 1,780 per 100,000. And unfortunately, we have over 900 deaths in the state of Oregon now. Our statewide hospitalization is also going up. The 7-day average was 30 in the past 7 days. So we can go to the next slide. So this is our Washington County numbers. And again, you can see this is really only a 5-day difference. And so what that tells us is that our numbers are really, we have been well over 100 into the 200s and nipping at 300 on several days. So you can see our total number of cases in Washington County is just over 10,000, with an additional 289 presumptive cases, a total of 550 hospitalizations. And remember, this is a cumulative number, and 102 deaths in Washington County. And you can see that we're still dealing with a significant number of outbreaks in long-term care facilities, other congregate and workplace facilities. And the increase this week was 13% increase in new cases from the previous week. And the previous week was high, so another 13% is pretty significant. We'll go to the next slide. So this is really the same data, just in a different format. It's what we call our epi curve, our epidemiologic curve. And I think it's just really shows the stark difference. When March 23rd, a lot of us thought it can't get worse than this. And we were worried about bending the curve. And we were, really concerned about the significant number of cases on March 23rd. And you can just see the exponential increase that we've seen really since the end of October. So next slide. Just as a reminder that we do continue to have a very significant disproportionate impact of COVID-19 in our Latinx community. So I think I want to make sure that we remember this and that we're revisiting this each week when we look at our data, so that we continue to make sure that we're focusing on what can we do to support this community and the significant disproportionate impact. So next slide. So right to the new metrics. So on Wednesday, before Thanksgiving, Wednesday afternoon, our governor announced that she's replacing our phase 2 readiness and watch list with new metrics. And Chair Harrington mentioned this earlier today, that public health in the metro region did have some input into these metrics. We didn't get everything that we asked for, but we really definitely felt listened to by the governor's office, and several of the important components that public health was advocating for, you will see in these metrics. So what we think are the positives is that this is really aligned with the new school metrics. So there's not a lot of different metrics for different purposes. Its disease activity metrics really determines risk level and activities that's allowed based on that. So we're looking at case rates and percent positive tests. There's other metrics that OHA will report on and that public health will be following that really serve the purpose of providing context and early warnings of the disease spread. And the other piece is that Clackamas, Multnomah, and Washington County, as of tomorrow, when these new metrics go into place, are no longer tied together. We're tied to our disease case rates and our test positivity. We can go to the next slide. So the metrics are set up with disease activity metrics that really, there's corresponding activities that are allowed depending on the disease risk. And it is a matrix that goes from widespread disease within a community, within the county, and that is labeled as extreme risk, down to minimal spread or low risk. And there's community activity mitigation measures that are based on this risk. So we think that it will be easier to understand. One thing that the governor has allowed is that counties can decide that they want to stay in the more restrictive risk level. So if we fell down to from extreme risk to high risk, the county could determine that they want to continue the activity restrictions that are associated with extreme risk. So county boards do have more authority around risk. So we'll go to next slide. Okay. So these are the actual indicators that we'll be looking at. So you can see the case rates from above 200 per 100,000, which remember we were over 300, down to fewer than 50 per 100,000, which is the minimal risk level. And for smaller counties, they're looking at some different measures over that same 14-day time period. And then we're also looking at percentage of test positivity over the past 14 days as well. And so those are the two measures that will really determine where we are in the risk categories. So go to the next slide. So this shows you in the metro county where we are. And you can see that all three of our counties, because of our case rate, fall into the extreme risk category. Some of us are close on the test positivity, but because of our high case rates, we will remain in the extreme risk category. Go to the next slide. So this chart is showing test positivity, and it's comparing person-based positivity to test-based positivity. And CDC uses test-based positivity, and with these new measures, Oregon is moving to this test-based percent positivity rate, which is, it's probably more, it's closer to what we all think about. It's very simply total number of tests done and the number of positive tests. So it's just a ratio, a percentage. So the denominator is all tests done, and the numerator is the number of positive tests. And it's very specific about, so for example, it doesn't include antibody tests. I think what's interesting about this chart, and the reason I showed both, even though it might be a little bit confusing, is that there's a lot of questions about, isn't it just because there's more tests being done? And when you look at this chart, no matter whether you're counting people that are positive or the percentage of tests that are positive, you'll see that it's going up. So what that tells us is that there really is widespread increases in COVID within our community.
Just quickly, Barney, just to refresh my recollection, what is the ratio pieces on a person-based percentage positivity? What's the numerator, et cetera, for that?
So when we look at person, they're taking out, they're not counting all tests. The denominator is the number of people that were tested, not the number of tests that were done. So okay. If you got 4 tests, you're only counted once.
Gotcha. Yes. Thank you. Yep.
Yep. Okay. So next slide. So I just wanted to make sure that you are aware, because you may be seeing some of the data reports that we send out, and oftentimes we'll say many tests were not processed, or some tests were not processed. And so we just wanted you to know that with the high case counts, labs, and the number of users, that the state data system is struggling and it's not functional, and it's really slowing us and staff down across the state. There's delay of entering laboratory results, and then interview data because of the slowness of the system. So we're doing the interviews, but it's being entered into the system at a really slow pace, and it could be up to 2 weeks after the interview. I've been told it can take 20 to 40 minutes to enter the data. And when you think about, having 150, 200, almost 300 cases a day, you can do that math and figure out why this is taking so long. So what this does mean is that we have considerable delays and missing information across all areas of our data collection. I want to emphasize this is not a Washington County problem. Our staff are fabulous. This is really a statewide data problem, and it's something that the state is working to correct. And hopefully they'll get that figured out really quickly. But we just did want you to know that this is going on. So next slide.
So Marnie,
Sure.
Marnie,
Sure, yes.
to go back to that.
Mm-hmm.
So could you summarize what the key message is here for the public? Is it that they should not, you and your team work really hard, as well as the state, to make sure that we in the public have the best available data. I think what I've heard in all of this is it continues to be really challenging for you to get that information into the system. But the bottom line is the data that you folks are dealing with and the state is dealing with is sound information and will continue to be sound.
Yes, the data is sound information. It's accurate information. It's just taking longer to input the data. So it's just behind. We're just behind when we report some of what we're learning. I think that the takeaway message too is in the next slide, we'll explain a little bit about what we're doing. But the takeaway message is just like the healthcare system, our public health system at the state and local level is overwhelmed by the number of positive cases, the number of people that need to be in isolation and quarantine. And it's affecting our staff and it's affecting our data systems, just like the healthcare system. We hear messages all the time about the healthcare system being overwhelmed. Our public health system is also in a place of seeing unprecedented number of cases and people that need support in isolation and quarantine. And so the next slide tells you a little bit about what we're doing about that because of the high case counts. We can go to the next slide, please. There we go. So because of these higher caseloads, we have to focus on the highest priorities. And those are cases that are most at risk and they're large outbreaks. We're prioritizing high-risk facilities like long-term care facilities, congregate housing like our jails, our shelter, manufacturing and processing. So really focusing on where this has the potential to spread and to spread to the highest risk populations. We are no longer able to do monitoring on lower risk cases. And we really are referring low risk individuals and low risk work settings to 211 to get general education and support. So we're also changing, we can go to the next slide. Whoops. Okay, maybe it's must be, I think things got a little bit out of order here for me, but we'll just go with the order that we have it in. So I think I have a slide further down about some of the communication that we're doing. But we talked about the new metrics that the governor has put into place. and that these metrics are tied to activities. So this is just a little snippet, I called it, of the activity chart on the governor's website. There's 4 boxes where you can go and you can look at this activity chart and you can say, okay, what's going on with restaurants? And look at, okay, we're in extreme risk in Washington County, so you can have a maximum of 50 in your eating or drinking establishment, depending on the ability to physically distance. 50% capacity, so they can have 50% of capacity. You can look at indoor recreation and learn that certain things are not allowed, like gyms and fitness centers. So this chart, I think, is really something that anybody could go and look at and learn about what is allowed or not allowed, all the way down from extreme risk, which is where Washington County and the whole metro area is now, down to the lower risk of the chart. So we'll go to the next slide. So I just wanted to remind you that the governor's freeze ends tomorrow. So we will move to the new activity chart and extreme risk category tomorrow. And then also that we can go to the next slide, that there is also still a West Coast travel advisory, and that does continue. So this change in risk, we can go to the next slide, please. The change in risk category does not make the West Coast travel advisory go away. Okay. So I'm still seeing the governor's freeze. Okay, one more and then we'll be caught up. Thank you. Okay. So here's the other piece that I wanted to really, how we've shifted our message, both because of the governor's new risk categories, as well as our need to really get the message about our public health system is overwhelmed, and so we need your help. So we are certainly continuing to focus on the Latinx and other disproportionately impacted risk populations. We now have bilingual, bicultural, Spanish-speaking communication person working with us, Ava. And she's doing a fabulous job of really working with our community-based organizations and our contractor, Lara Media, Somos, and others to try to get this message out in a variety of different formats to the Latinx population. We're continuing to amplify the governor's message about staying home unless they're essential trips, limiting our gatherings to 6 with no more than 2 households, and all of the messages that the governor's office is continuing to get out. But because our public health system is overwhelmed, the other message that we're really emphasizing is don't wait for public health to call. Test results are taking longer. We're getting more positive results. So we're asking people, don't wait for us to call you. If you went and got a test, you did that for a reason. So you need to stay home and wait for those test results to come in, or wait for your doctor to call you with the test results. Don't go to work. Don't go out unless it's really essential. If you do test positive, again, don't wait for us to call you. Isolate yourselves from others in your household. Isolate at home. There's a great video on our website that really helps people to know how to do that when you're at home. And also go ahead and start notifying your close contacts. And again, we have a great resource on the webpage about what to do if you test positive. So we're asking people to help us. We know what we need to do. If you're sick, you need to stay home. If you've got a COVID test and you're awaiting results, stay home. And if you get a positive test, please start notifying your close contacts and asking them to stay home and to not go out until you can verify that you did not also develop COVID. Okay, and I think now, so just a quick update on isolation and quarantine. Again, these numbers are growing. We've supported over 2,000 households. The need continues to rise. We saw 172 new families that needed assistance just in the last week. We can accomplish this only because we have really strong partnerships with our community-based organizations. And actually that number should be 23 community-based organizations have supported our referrals. That's my number dyslexia, I think. 20. So we have over 23 organizations that have been helping us with this. You can see that families in Asuncion and Centro Cultural have both served nearly 400 families each. And then our Washington County team has served an additional 934 families. So it's a big job. People really need a lot of help to be able to comply and sustain themselves when they're isolating and quarantining.
Marnie, Commissioner Treese has a question for you.
Okay, great.
Thank you. This question really is about the future. And that is that when I know that there's plans in the works for the distribution of vaccines. And I support the waterfall that's been established. But what I'd like to know is how would we go about advocating for within that waterfall approach, making sure that our Latinx and disproportionately affected communities have the first opportunity for vaccines?
That's a great question. We have, I do have a slide on vaccination. And one of the things that I was planning is that next week, I would ask a couple of our vaccination planning experts and leads come and talk to you. You've probably heard there is today a big meeting at CDC where they're finalizing how populations will be prioritized. We have definitely been advocating for, I think what we're hearing most is that healthcare workers will be prioritized first. And what we're hearing from the state of Oregon immunization program is that our first batch of vaccine won't even be enough to vaccinate all healthcare workers in the state of Oregon. So within that, there'll be some more prioritizations. One of the other priorities that we have identified and has really been discussed nationally is BIPOC communities because of the disproportionate impact. So we support that at Washington County, but they're still working to finalize exactly how that prioritization will work. But we are definitely already having conversations with organizations that support our BIPOC community and healthcare organizations that provide services to talk about how do we assure that they have priority access to vaccination as that becomes available.
Thank you, Marnie. I just have a great deal of concern about making sure that through the vaccination process, we at least I own the fact that we had this disproportionate effect. So thank you.
Yes, thank you. So that's a great segue to the next slide, which Latricia is going to talk about a bit.
Great. Thank you, Marnie. And good morning, Chair Harrington and board. I am Latricia Tillman, the Chief Equity and Inclusion Officer. And I wanted to share some of our community engagement work related to COVID. And I realized that later this week, the board is also further developing your community engagement strategies. And I'll be listening and happy to engage in whatever way you feel would be useful with that conversation. And my goal is to ensure that we align our work as the Office of Equity, Inclusion, and Community Engagement to help advance your strategic goals. But specifically, as it relates to where we find ourselves today with COVID, I want to share what we're thinking about tactically within the county administrator's office, so broader than the Office of Equity and Inclusion and Community Engagement, and then gather any reactions, thoughts, or feedback you'd like to share. So we want to make sure that we stay engaged with elected leaderships across the multiple jurisdictions within Washington County to keep them informed so that they can amplify a consistent message with their constituencies. Elizabeth Mazzara-Myers is on point for coordinating those meetings with elected officials. The CAO communications staff is supporting the good work of our communications expertise within public health and supporting alignment, expanding that capacity where we can. And specifically, OEICE and the CAO, a couple of mouthfuls, the Office of Equity, Inclusion, and Community Engagement, the County Administrative Office, are supporting work led in public health to center and elevate the experience, values, and resilience of the Latinx community with culturally specific communication. So this is a little bit different than translating messages. It's about creating messages in Spanish, recognizing the different cultural and value nuances and the disproportionate impact of COVID on the Latinx community. We're coordinating also and supporting where needed with public health as they continue to do outreach focused on the needs of the business community. And then wanted to just spend a little bit of time talking about general public engagement and specifically about a town hall. And this is something that originated in conversation with the chair. We have a town hall tentatively scheduled on Saturday, December 12th from 10 to noon. And the structure will really build on the positive experiences and effective format and processes that were used with the community investment conversation. So we'd basically reuse that format, but focus it on COVID to create more awareness within the community and then to help the community bring their questions to the board. And we want to make sure that we have the support of the entire board for that town hall and make sure that December 12th, which is a Saturday morning, works so that we could move forward with planning.
So I'm just pausing to see if
Commissioners,
you.
when we were first dealing with the new coronavirus crisis and the associated economic impact, we really did everything we could to step out of the way and ensure that staff was able to marshal across the agency to step forward and meet the public's need. What we talked about in May, as we regrouped to see where things were at, is we delivered the message to our then interim CAO that we needed to make sure that the board was not forgotten in our efforts to help our community understand the systems, the resources, and the key messages. Hence, following up with a second ever COVID town hall. I'm pleased to hear that we now have a placeholder. I think we've all seen the great logistics that our team is able to provide in support of our needs. So that was the request that I made to our staff, carrying forward and amplifying your wishes. Do you see that as something that you can comfortably participate in as well on Saturday, December 12th?
This is County Commissioner Scouten. Yeah, I already blocked off just now the morning of the 12th, though I'm also available in the afternoon. It's actually a fairly wide open day for me, so thank you.
This is Roy. I'm not certain I can do that. I have looked at my calendar as well, and so I may not be able to make it, but it sounds like a majority might, so that's great.
I should be able to be there.
Okay, thank you, Ms. Tillman.
Thank you. Let me just add one comment to Commissioner Teresa's question around vaccine. I think one of the things that we have to be really thoughtful of as we think about rolling out vaccines is a very well-founded and historic distrust from communities of color for new vaccines, given that there is a whole history of communities of color being used as test subjects. We have the history and legacy of the Tuskegee experiment. And so the more that we can do community engagement and increase our transparency and our communication and our relationship, most importantly, our relationships with communities of color, including the Latinx community, that's going to be one of the major barriers we're going to have to address in terms of accessing a brand new vaccination. So I see this community engagement work as one step in that direction.
Thank you, Latricia. I agree with you, and I guess what I want to make sure is understood is that I'd like to advocate for the options for our disproportionately affected communities. But the communication is vital. Thank you.
Do we have the opportunity later in this presentation to go back to questions we may have, or is this that point?
Of course, it's up to you. I have a few more slides, but it's up to you, especially why Latricia's here with us. Do you want to wait or? Okay. So thank you, Latricia. We have really valued Latricia coming to Washington County and really kind of helping us think even more deeply about how we reach our different communities and serve especially the Latinx population. And I know that our staff feel really supported by her involvement and engagement as well. So we really appreciate this partnership. So we'll move on to the next slide. So the other piece with this new disease related risk categories is that we will need to get out information to our business community. And so our compliance and business support team will be doing a lot of work. They've already started doing a lot of work sending communication to restaurants and other public health regulated sectors, conducting outreach to the businesses through chambers and local municipalities. And they're going to be coordinating a question and answer with the state reopening team. So making sure that our local businesses are aware of that and able to participate in that. We also, just like with everything else, we will need to make sure that our bilingual, bicultural business community members also are receiving this information in a way that's useful and helpful to them and providing any supports or information that they need. So we'll go to the next slide.
Marnie?
Sure.
Marnie?
Yes.
Back on that previous slide, please. So Washington County is the agency that does all of the licensing for the restaurants and food carts across the county, correct?
Yes. Yes.
Approximately how many is that gross number? I know it's over 1,000. Yeah, it's a
I
lot.
wanted to say it's close to 2,000, but
Right.
I don't know off the top of my head. I should
Yep.
know because
So
I
it's a
just saw
lot.
that number. Yeah.
Yeah, it's a lot, and that's a lot of contact to be done. And I want to make sure that right now we're in this wonderful opportunity time where we need to make sure that they understand the metrics, but also there's this very short window where those who have been impacted by the freeze that the governor put in place know that there are resources to help with the blow that caused with their having to close. So, you know, it's both a harsh message to deliver, yet an opportunity as well for some financial resources to help. So I know it's a huge lift. So thank you for all of that contact and helping those people get connected with the resources that can help them as owners and operators.
Yeah, and just as a reminder, the board approved, and this is off the top of my head, but I believe it was somewhere in the neighborhood of $1.8 million from our own coronavirus relief funds to support restaurants, food establishments, and our also hotels that needed assistance. And that information went out to everyone about 3 weeks ago, and we're getting the opt-ins because they basically have to certify that they have been impacted. And so we're getting those funds to those establishments as well. So thank you. Okay, so we'll just run through quickly some of the updates that I've been providing. We continue to operate several strategies for our homeless community members. The Safe Sleep Village did close on November 16th because we were able to open the winter shelters. And so the folks that were at the Safe Sleeping Village have either been moved to the winter shelters or the respite center or some of the hotels that we're using through Family Promise hotel vouchering. So one thing to know is that our winter shelters, we have approximately 150 beds. We were really near capacity almost immediately, and we have about 30 people that are on a waiting list that we're continuing to work with to find resources for. So we continue to be really busy in trying to prevent COVID infection and serve our homeless community. The next slide. The respite shelter, we continue to operate both wings. The east wing is our COVID impacted wing. That's where if somebody doesn't have a place to recover, if they're COVID positive or to quarantine, that we put them. And then we also have the Safe Sleep on the west wing, which is where we've moved quite a few people from the Sleep Village, the Safe Sleep Village, and other homeless programs, including the Safe RV parking. So we'll go to the next slide. We're getting there. Just an update on the child care and educational support programs. We continue to receive applicants and to make awards to qualified child care providers. And also that we've had really over 2,200 applications for child care reimbursements that have been submitted through the school districts. And so that shows that there was really a need out there, that parents are taking advantage of that. Most school districts, we believe, will fully expend their funds. We have a couple that are concerned that they may not be, so we're monitoring that closely. And because of the way that we have provided this funding and that school districts are responding, the school districts will be able to offer these services into 2021. So that's a great service for our parents. So COVID vaccination, next slide, please. So this is really just a teaser. Commissioner Treese, thanks for asking your questions. I'm sure that you've all heard the news, but there are 3 promising vaccines on the horizon. There are some significant logistical challenges with planning, both how we prioritize, how we deliver the vaccine. One of the vaccines has to be stored at below your normal freezer temperature. And so there's logistical challenges in getting it to locations and that have the capacity of that level of a freezer. But the state and our staff are working on plans, and as I said earlier, there's a CDC meeting today, and our staff has been invited and will participate on a CDC briefing tomorrow afternoon. And I actually, if you're interested, thought it might be great to have our leads on the vaccine planning team to come and talk to you next week, more specifically about the vaccination and how they're planning to get the vaccines out there. Sure, Chair Harrington.
I think that's a great idea. I'm really surprised by some of the reactions that I've seen people have on social media. Some of them quite ill-informed, that by virtue of a vaccine being first available, that magically, it seems, we can get rid of all these restrictions and go about our normal business right away. So if in the material that you and the team put together for next week, if you can help ensure that there is some appreciation of the deployment over the course of time and what it's going to get, what it's going to take time-wise to get to a safe point for more of that healthy mingling that people are longing for, and that it isn't going to be something that we can do within a day or a month or even a couple of months. It's going to take time.
Yep, absolutely. Well said, and we'll make sure that that's covered. Thank you. Okay.
Marnie?
Next slide.
Marnie?
Yeah, yes.
I have another question. Can you give us an update, or are you, and maybe you don't have this information, but OHSU announced a vaccine trial, I believe it was yesterday. Do you have any information about that and just what they're doing?
Yeah, I'm sorry. I also saw that just on the news this morning. So I don't have any more information other than what was on,
Okay.
Channel 12, but I can ask the team to talk about that next week.
Okay, thank you.
Sure. So this is the next slide. Oh, no, we're good. So this is just a reminder. We got past Thanksgiving. We're very concerned about what our numbers are going to look like in the next 7 to 14 days. But it didn't end with Thanksgiving. This is the time where we all, as you said, Chair Harrington, we're longing to be with our friends and family. But we just are really begging people, please, please just share meals with your immediate household, meet with others virtually. We know that's a big ask, but there is light at the end of that tunnel. But I think as Chair Harrington said, that tunnel is very long. The vaccination is not magical, and it's not going to be completed in December. It's going to take several months to get everybody that we need to be vaccinated so that we can start slowly moving back into more normal social gathering that we all are longing for. So we're asking people to remember to limit that social gathering, wear their masks, and with shopping season coming up, really, we think it's a better idea to avoid those crowded malls and to think about shopping online. And Chair Harrington, you have a comment?
Thank you, Marnie. I'm hoping that you can help me with 2 items. earlier in the presentation, you spoke about the travel restrictions, and some people were already in progress, and others still moved forward with their travel. And so folks are hopefully doing the responsible thing of quarantining at home for 2 weeks upon their return to their homes here in Oregon. Here we are, as you said, post-Thanksgiving, and some folks have plans to travel, whether in-state or in the Northwest or beyond for the Christmas holiday time. So the first question I have really goes to those travel restrictions. Do those expire tomorrow, or do they continue into the future?
The travel restrictions, it's my understanding that they do continue into the future. They are not expiring tomorrow. So unlike the freeze that expires tomorrow, the travel restrictions continue. And so we're asking people not to travel unless it's essential. And if you do have to travel, that you would need to quarantine for 2 weeks when you return.
Okay. Then the second area that I'm hoping you can help me with is there is this new risk-based system, and I appreciate the clarity of it and all the work that your team and OHSU have put into this. So here we are now, December 1st, and the academic school year for public schools takes a 2-week break starting the week of December 2021 through the return January 3rd. So really we're into the first work week of December, and there's only 2 more after that, so a total of 3. But as I understand the cadence of this new system, the state will be taking these data snapshots on a weekly basis. And all of us have received an email from the state, and I tried to amplify that in folks' inboxes. According to that information, the state will take another snapshot and have an announcement on December 15th to let us know if we are staying in extreme risk or if it will continue. What that tells me is that all of us need to do our part to ensure that folks know we're in extreme risk, and we very well may be staying there all the way through the New Year's holiday. So I think that's a very important message that we get clear now. And I'll need you to make sure I get this right as well, and that you'll give us some updates in the next week or so, because unless the numbers change significantly, it looks like we're in this extreme risk for the foreseeable future. Am I getting it right? Because it is a new system.
Yes, I have been asked at several meetings to bring out my crystal ball, and I do not see any path for us to get out of extreme risk in the month of December, to be honest. Our numbers are too high, and we haven't even seen what we expect to be a bump post Thanksgiving in the next couple of weeks. And we have to be below that 200 per 100,000 for at least 2 weeks before we can move to a lower risk category. So I will, and I hope that I have to eat crow, but I don't think that that's going to happen. Yeah.
Thank you for helping me get my head around that, Marnie, because, I'm just as human as everybody else, and I want to get out there, and being jolly and joyful with my friends and get together. And it's just not the safe thing for us to do. There's a lot of suffering, a lot of terrible struggle with this virus. And the recovery stories that I've been reading are very unpleasant to horrific sounding. So thank you for helping me get my head around it.
Yeah, thank you. And I think that we all want to be jolly and joyful with our friends, but we want to be jolly and joyful with our friends for many years to come. We don't want to see them in the hospital or on a ventilator or, you know, a really horrible outcome, including even death. So we do this because we love and care for our friends and our family and our community members. So absolutely, this is really hard. And we appreciate everything that everybody's doing to try to follow these really difficult, especially during the holidays. It's really difficult to not be with extended family. But we do it because we love our extended family and our friends and our community. And the last slide is just that I think that, you know, that light at the end of that long tunnel it's actually getting a little brighter because we do have some promising vaccinations on the horizon. But I do want to remind everybody to get a flu shot. And because there's hope at the end of this, we have to just double down on all these messages that we've been talking about. So thank you to everybody for your work to do that. That's a great mask. So, and with that, I'll take any questions.
Commissioners, the floor is yours.
I have a couple of comments. I don't want to belabor this because we've been going on a long time. Always appreciate the thoroughness of your update. Always disappointing. It doesn't get any better. And I see your last message on the board is hope, and I'm hoping that there is hope. But I mean, that's what we all hope. In your comments with the governor, I would say that if we're ever going to get back on our feet financially, you can't use terms like extreme risk. People who are not just doing business in our townships here, they're doing business across the country and around the world. And the meanings of words are important, especially for international shippers and cross lines vending. So I would encourage, I know you don't have much to do with it, but when they're using terms that are so negative in trying to ship goods and products to other parts of the world, it is not helpful to our local economy. So the extreme risk category, and I'm speaking to the choir here, but extreme seems to mean something to them, means very different economic consequences to others in our state. So I would take I guess some concern. I have a lot of concern about that term. My other comment real quickly is that you've done a very thorough job explaining what COVID is related to public health. At some point with the new administration in Washington, as we ask for funds, I think we need to be a little bit more broad in the consequences of this. This is just the disease part of it. I mean, there's an increase in suicides, there's an increase in drug and alcohol use, there's an increase in domestic violence, there's an increase in divorce rates. And so if we want to make a case for what Washington County might need in terms of dollars, I certainly think you've made a compelling one on the vaccine side. But I think there's a bigger message to be told, and as we advocate for dollars at some point, which we'll do, I think maybe we need to start looking at the little broader aspects of all of this, just not the disease aspect. Not diminishing that, I'm just saying that there's a lot more consequences. So I would encourage you to do that as well.
Okay. Thank you. That's helpful. I can certainly add some of those components. Thank you.
Anything else from the other commissioners?
I just want to say thank you again. I know that this has been a really tough time for Marnie and your team, and I know how quickly you had to respond after the governor's press announcement, and so just thanks for the work and thanks for the time, and please extend my appreciation, and I believe the appreciation of the board to your staff as well.
Thank you. Yeah, and it's a good team, including you all. So we appreciate the support we get.
I was just ditto the comments made by Commissioner Trees. Thank you.
Thanks.
Yeah, thank you, Marnie. I know it's really hard on your team. You're supporting so many people in need, and during a time of year where we do try to be a little bit more joyful and gather together and look forward to a new year at a time that, boy, your staff is really in the trenches looking at this every single day. So thank you for all that work. Thank you for helping me and others understand the current state of affairs and what community spread of this disease looks like. There's no denying it, and that we need to do our part. I'll say for myself, as I drove home from the TVC TV studio, I made a point of driving through a couple of extra neighborhoods so that I could take in some holiday lights. So it's some of those little things where, no, we don't get to hang out with our friends or meet at a restaurant for a meal. But there are some things that we can look to be a change of pace from staying. I feel quite sequestered in my house, but I need to make an effort to get out and experience some of that connection. So thank you for your great ideas as well. Really appreciate it. All right, well, we'll look forward to learning more from Marnie and her team next week about the CDC and state and hopefully Washington County, as well as the health region's plans for early deployment of these hopeful vaccines, and what are some of the logistical things that we may need to try and support to ensure that just as she and her team have worked hard to get testing available to our historically disadvantaged community members, that we are also working in partnership to others to get the vaccine deployed and get really good, accurate, trusted information available to everyone. So great. Thank you, Marnie. Keep up the great work. All righty, so on to the next items on our agenda. The first one is a public hearing. So we need to hold a public hearing related to the adoption of rates and charges for clean water services for fiscal year 2020 to 2021 through June 30th of 2021. Do we have the legal folks here for Clean Water Services as well as you, Ms. Taniguchi-Dennis?
Yes, thank you, Chair Harrington and Board of Clean Water Services. The purpose for today's public hearing is to consider the continuation of the rate deferral for the rate increases that had been planned in 2020, to continue to defer these rate increases through June 30th of 2021. And this proposal is being done in recognition of the continuing financial impacts that many of our families and businesses are still experiencing from the pandemic. And Clean Water Services will continue to proactively manage its budget by prioritizing and sequencing of the planned capital and operating investments. These rates are needed for Clean Water Services to protect water resources and to meet the needs of the region for sanitary, sewer, and stormwater services, our critical infrastructure for the region. And this requires investments in its aging infrastructure, as well as investments in the watershed itself.
And we also want to maintain the long-term water supply security of the river, and also meeting of our more stringent federal and state water pollution control needs. But we believe that this deferral is needed in the region to provide our folks breathing room to be able to recover from the pandemic. With us today is Kathy Leader, our Chief Financial Officer, who can provide additional technical detail about this deferral and to answer any questions that the board may have. Thank you.
Thank you, Diane.
Before we go any further, can I get an answer to the question if we have our legal counsel from Clean Water Services participating in this meeting?
Yes, we do, Madam Chair. Mr. Linder is joining right there for you.
Thank you. I could not see him earlier. Thank you. All right. Go ahead, Ms. Leader.
Thank you. Good morning, Chair Harrington and members of the board. I'm Kathy Leader, Chief Financial Officer with Clean Water Services. I was really going to just do a very short narrative and introduction to this public hearing. As Diane had reiterated, the R&O before you and the rates and charges are proposing no increases in rates in the current year through June 30, 2021. We had held a work session with the board back on November 17th, and we were directed to come back during the budget process this next year and talk about the impact of deferral of rates and what future rate increases might look like and investment in our watershed. And that concludes really my staff report, so open for any questions you might have.
I don't have any questions. I'm pleased. I'm not unmindful. I think none of us are unmindful of some deferrals that we'll have to make in terms of capital investments. It's not a trivial thing to postpone these rate increases for another 6 months, but under the circumstances, I feel like we collectively are making a contribution in some way to mitigate a lot of the hurt that's out there economically. And so I do support this.
I'd move for the requested action.
I'll second it.
Wait, commissioners, it is a public hearing, so it'd be best to open the public hearing before a motion.
I can't hear the chair. Yeah.
Commissioner Treese, did you have any questions? Okay. Seeing no further questions from commissioners, I'm going to open this public hearing on this resolution and order recommending deferral of rates. Mr. Moss, is there anyone signed up?
Yes, Madam Chair, we have one person signed up, Mr. Dale Feek. Dale, can you hear us? Do you hear us, Dale?
Dale, we can hear you.
I can't hear him.
So Dale, you're not coming through to us. So if you have comments, if you want to submit them via writing, we will include them in the record for you.
Okay, well, is there anyone else, Mr. Moss?
There is not, Madam Chair.
Okay, so I'm going to close today's public hearing. Commissioner Rogers, before we had the public hearing, had made a motion that we adopt this resolution in order, and I heard a second from Commissioner Treese. Did I capture that correctly? No,
The second was from Commissioner Scouten.
Oh, okay. We have a motion from Commissioner Rogers and a second from Commissioner Scouten. Are there any comments before we take a roll call or take the vote? No questions? Okay. All those in favor, please vote by saying aye.
Aye.
Any opposed? The motion passes unanimously 4-0. Thank you, commissioners. We'll then move on to the second item on our action agenda. This is from County Administrative Office. to amend the emergency declaration related to COVID-19, to expand the authority delegated to the county administrative officer related to coronavirus relief funds.
Madam Chair, if I may, I think we skipped over item 6A from Clean Water Services.
Oh, yes, you're right. Gee. Thank you. I went from one Clean Water Services item to thinking we'd covered it. Thank you so much, Mr. Moss. We'll go back to item 6A, where we need to conduct a second hearing. So is there a staff report first before we hold the second public hearing?
Do we want to read by motion for title only?
Yes, please. Commissioners, do we have a motion to read this?
So moved.
Second.
All those in favor, please vote by saying aye.
Aye.
Any opposed? The motion carries unanimously 4-0. So we'll move on, please.
Conduct second hearing and first public hearing of ordinance 42, an ordinance prescribing rules governing the discharge of non-domestic waste to the publicly owned treatment works of Clean Water Services, amending ordinance 27 and repealing resolution and order 09-01 and adopt ordinance 42.
Thank you. I'm looking forward to having a bigger work system here so that I don't lose my place in the meeting. Okay, so we've had the second reading, and now we're going to have the first public hearing of ordinance 42. Before we do that, do we have a staff presentation on this ordinance?
Yes, we do, Madam Chair. We have Robert Baumgartner from Clean Water Services to present. Robert, can you hear us? Robert, you're muted.
Sorry about that. I apologize, Madam Chairman, members of the board. My name is Robert Baumgartner. With me is Joy Ramirez from our Environmental Services Program. We have provided a presentation before. I will cover our proposal very quickly. We are required by federal requirements and state requirements to have a pretreatment program that controls the waste discharge to our collection system. We also have a local program that we implement to control or limit the waste that may cause problems at our wastewater treatment plants or within our collection system. About 2 years ago, we undertook a deep review of our program to identify what was working well, what was not working well, where we were consistent or inconsistent with federal requirements. Based on that review, we elected to update our ordinance to be consistent with those requirements and consistent with our requirements or needs for a local program, and also to provide a lot more transparency within our regulatory structure. So we decided to put all of the ordinance, all of the requirements into a single ordinance rather than have them distributed through several ordinances. We based much of the work we did on guidance from state and from both EPA and Oregon's DEQ. After completion of that ordinance, we did work with CWAC to provide public comment and public review. We have completed that review. We have made several changes based on the input that we have received, and then we completed the review. This is the second reading of that ordinance. During the interim, we have also interacted with Oregon's DEQ to make sure that they agreed with our impression or our understanding that we were meeting the regulatory requirements as they understand them. And with that, I will turn it over to Joy Ramirez, who really has done all of the work for this to make sure that I did not miss anything of importance in this summary. Joy?
Thank you, Bob. Thank you, Chair Harrington and members of the board. as Bob has captured everything that we have outlined in our previous presentations, that this non-domestic waste ordinance is in support of our federal pretreatment program to provide that additional clarity that we can do program updates to ensure that we are continuing to provide protection for the watershed and for the system that discharges to it. Is there any questions?
I know I don't have any questions. You gave us some pretty thorough presentations on this information at our work session on October 27th, as well as with the first reading of the ordinance back on November 17th, our last meeting. So thank you. But I'll double check. Commissioners, do you have any last questions? No? Okay. Seeing none, then it looks like we can move on to the first public hearing. Opening the public hearing for ordinance number 42. Mr. Moss, do we have anyone signed up to testify today?
We do not, Madam Chair.
Okay. We'll then close today's public hearing on ordinance number 72. What are the wishes of the board with regard to this ordinance, which prescribes rules governing the discharge of non-domestic waste to the publicly owned treatment works of Clean Water Services, amending ordinance 27 and repealing resolution and order 09-01 and adopt ordinance 42?
Move for adoption.
Is there a second?
Second.
We have a motion and a second to adopt this ordinance. Mr. Moss, could you take a roll call vote, please?
Absolutely, Madam Chair. Commissioner Rogers.
Aye.
Commissioner Treese.
Aye.
Vice Chair Scouten.
Aye.
Chair Harrington.
Aye. Motion carries unanimously 4-0. Okay, we've got 5 more action items left. We'll move on to item B, to amend the emergency declaration related to COVID-19 to expand the authority delegated to the county administrator. I'm so used to saying county administrative officer, related to coronavirus relief fund CRF. Ms. Tanya Angie, do you have a staff report? Or Alan Rapplier?
County Council will be providing the report. Thank you, Chair.
Yes. All right. Madam Chair, members of the board. During this COVID emergency, we've had emergency declarations and emergency powers, and one of those emergency powers was delegated to the county administrator to approve contracts for up to $500,000. As you well know, under the CARES Relief Act funding, we have to expend quite a bit of money between now and the end of December. So we have proposed to amend that emergency declaration to grant the county administrator the ability to spend those CARES funds pursuant to the policy direction that the board has already granted. So this should provide the flexibility to get those dollars out of the door and into the community where it's so desperately needed. So I'm here for any questions on that. Oh, and one other matter, carrying forward to the next declaration in later December, this power will continue. I'm here for any questions.
Thank you, Mr. Rapplier. I would just like to add that Tanya Angie convenes the Coronavirus Relief Fund CRF work group, which includes Commissioner Rogers and myself. And the need for this authorization at this point is really to ensure that in these last few weeks of getting these funds deployed and in the subsequent accounting of it, that the team has the mechanisms in place to effectuate those dollars per the same framework, per the same U.S. Treasury guidance, but to do so as quickly as possible without our meeting schedules getting introduced as potential roadblocks. So really that's the heart of the matter and why we have this action before us today.
I would like to add to that, Chair, that you're absolutely right about why this is so important. And the most important reason to me is to get this money to the end users in our community. So this is a responsible action for us to take. Thank you.
Commissioner Rogers, you were part of our in-depth discussion in our meeting last week. Is there anything you'd like to add?
Not really, just the same thing I said in our work session, that I think we need to be flexible, nimble. We've got less than a month to spend this money, and there's going to be certain adjustments that need to be made. So I would move that we approve the action.
Second.
We have a motion and a second. Commissioner Scouten, did you have any questions on this?
I do not. No.
Okay. Alrighty. All those in favor of adopting this motion to amend the declaration of emergency to expand the authority granted to the county administrator related to CARES Act funds, please vote by saying aye.
Aye.
Any opposed? The motion carries unanimously 4-0. Next, we'll move on to items that we pulled off of the consent agenda for action. The first one is what had been item C, excuse me, item A on the consent agenda to approve the goal sharing award for continuity of operations under emergency conditions. Do we wish to have a brief staff report on this item before we open it up for commissioner comments and action?
Not really.
Okay, well, I'll just refer folks to the consent agenda packet that this is an item under Clean Water Services where we have a proposal to take one of the Goal Share Awards, which is part of the compensation package for all employees, and to award that Goal Share point for the services that all of the employees of Clean Water Services followed through on under the emergency conditions related to this coronavirus effort in the global pandemic.
I would like, just as for the record, if we could hear a brief report from our CWS CEO.
Thank you, Chair Harrington and Dick Scouten and the Board of Clean Water Services. The Board of Clean Water Services established a goal sharing program back in 2002 as part of the compensation program for the organization. Clean Water Services is not a civil service organization. It was designed to operate and structure its compensation similar to businesses. So the purposes of the goal share was to promote and incentivize and reward innovation and the collaborative work across the district. So it's been a very important tool to connect the employees to district-wide initiatives to build upon our past accomplishments for a year and to really stretch towards innovative solutions and to create more value for our customers and for the environment. So as part of the Goal Share program, we did not contemplate the pandemic occurring. And as part of the pandemic operations as critical infrastructure workers, they are asked to come to work day in and day out to continue to provide services, including things like working in raw sewage. And we do know that that is work that they do every day, but under a pandemic circumstance, it can be quite a challenge to maintain all of the physical distancing requirements as well as being protective of their own health and each other's health. The team continued to innovate under the pandemic circumstances. We've launched a nationally recognized wastewater-based epidemiology program, and we're working with Oregon State University and the National Science Foundation to help the Oregon Health Authority, and along with Oregon State University and Oregon Health Sciences University, to utilize our wastewater as a way to understand what's happening with COVID within our communities. The team, when we couldn't find hand sanitizer or wipes, the team invented their own that met the requirements of the FDA and all of the health organizations. And not only did they do it for themselves, they did it to share with other organizations more broadly. The team, when they saw a need for PPE with our agricultural partners and other community-based organizations, they partnered with the Washington County Emergency Operating Center and the public health folks to be able to expand our reach, to be able to get the needed PPE out to the community. And I do know the community members who did receive that PPE, it was very much in need, as both for businesses as well as for our agricultural workers. The team are doing things like, as people are flushing their wipes and their paper towels and other things down the toilet, because we were struggling even to find toilet paper at times in the region, they're in there with their hands, unplugging pumps and working throughout the time to do it. Also, both our non-representative and collective bargaining unit, we asked them to show up differently. We changed their schedules. We changed their reporting. We changed the way that they do work. And they've all been very dedicated to mission and to serving the region in a nonstop way. So we very much appreciate it. And it's a small list of highlights of what the team did to be inventive, to be innovative, and to continuing to show up for the region. We thought about it very deeply about whether or not to propose this, but for the team, what this represents to them is roughly $200 a month. So it's about $1,200 for all employees. So when you break it down, it's about $1.15 an hour. And when you look across the US and the region as to how people are wanting to treat their critical workers, this represents about $1.15 an hour over that time period. So when you look at what business and other organizations are doing, everything from grocery to healthcare, they call it hazard pay, but we don't have a hazard pay component within our compensation plan. They're on the order of about $2 an hour. So this is less than the $2 an hour, but it's really to show our critical infrastructure workers, thank you for showing up, and for our folks that are telecommuting, they are paying for their home offices through Wi-Fi and electricity. And I want to really thank the team at Clean Water Services for being so dedicated to public health and the environment. But I do understand how difficult it is during this time with the financial stress that's going on in the region. So thank you.
Thank you for that summary, Ms. Taniguchi-Dennis. Commissioners, do you have any questions, or would you like to make any comments at this time?
No, as I mentioned, I'll be voting no. I gave my reasons during the work session, and I'll just simply vote no.
Commissioner Scouten, anything?
I think that Ms. Taniguchi-Dennis did a great job of making the case to do this, and I will be supporting these changes and these additional pays.
Thank you, Commissioner Scouten. I would like to add for members of our community that your sewerage and stormwater agency, Clean Water Services, and the 379 employees, that includes our permanent employees, temporary employees, and interns, really just went to extraordinary measures to ensure that all of us here in Washington County, every resident in their homes, no matter the type, as well as businesses, had reliable service all throughout this year, not only during the global pandemic, but also during the wildfires, because many of these workers have to work outside. And if we remember those smoky, hazardous air situations, it was really tough. They've also done a lot of innovation as well. In the packet for this meeting, on pages 21 through 23 is an excellent summary, and Ms. Taniguchi Dennis brought more of that to life for us to remind us of what those working conditions have been like, how dedicated these employees have been, and the degree of innovation. The science of wastewater detection and looking for this protein that is the marker for this coronavirus as an early indicator of where there might be community outbreaks is really helping not only those of us who live here in Washington County and flush our toilets, but also throughout the state and the nation to make better informed public health decisions. So thank you very much. I will be supporting this Goal Share Award, and it looks like Commissioner Treese now has comments.
Thank you, Chair. I also wanted to point out that this goal sharing program is part of the strategy that, from the business perspective, that Clean Water Services has had in place, and the goal sharing program was to meet extraordinary actions on the part of the staff, and I think everybody here has outlined those extraordinary actions. So thank you. I'll be voting yes.
All right, do we have a motion to approve the Goal Sharing Award for continuity of operations under emergency conditions for Clean Water Services?
So moved.
Second.
We have a motion and a second. All those in favor, please vote by saying aye.
Aye.
All those opposed?
Aye.
And the motion carries 3-0.
Nope.
We'll move on.
Nope.
Next.
Madam Chair, it passes
3 to
3-1.
The 3-1. I wrote down 3-1 and I said 0. Come on, brain and tongue not connected. Next, excuse me. We'll move on to items Q and R, and we'll come back to L after that. Item Q, to accept the grant and authorize intergovernmental agreements with the state of Oregon for COVID-19 business assistance. Related to that is item R, to authorize intergovernmental agreements with cities and contracts with partnering organizations, excuse me, for a state COVID-19 business relief grant. And I believe Ms. Tanya Angie is here with Jack Leong, our Chief Financial Officer, to help provide some more context on these two items.
Thank you, Chair Harrington, Board of Commissioners. I had asked Board Clerk Kevin Moss to pull up a press release from Governor Brown, and I'll dive into that in a minute. The action that you have before you is acceptance of the state funds for business assistance. And we had this discussion during the work session. There was great feedback from the board. And one of the feedback points was relative to, there's a discrepancy between what we received in the IGA from the state, as well as Governor Brown's press release. So the language that staff are suggesting that we include, in addition to the priority areas outlined within the contract, include, and this is specifically from the press release that Clerk Moss had presented, and that this the press release was sent to the board as well. So I will direct your attention to the last sentence of the first paragraph. Kevin, you have it on screen, so thank you. Priority for the hospitality industry, business impacted by the freeze, small business, and women, Black, Indigenous, people of color, and tribal-owned businesses. So staff is suggesting, based on board feedback, specifically Chair Harrington bringing this press release to our attention, that we add this in addition to the contract language. So Jack can provide a little bit more detail on this in a further staff report. Jack?
Thank you, Tanya. Thank you. Good morning, Chair Harrington. Good morning, Commissioners. As discussed at today's work session, that we realized that additional information is needed for this agenda item to inform your board to make informed decisions. So we have quickly put together information from the state's grant agreement, also from the other communications that has been given out from the state via the e-board, via the press release that Tanya has just shown on screen. And we do have an updated agenda item for your review that has a lot of more information, also highlighting both the grant agreement strongly encourage priority areas as well as the other priority areas that Tanya just mentioned. And I like to apologize for not including this information for in the earlier item, and which triggered this last minute changes. When we were drafting this agenda, we actually didn't have a lot of these details available to us. So this program is the one that's moving quite fast from the state perspective. So, with this updated agenda item, we actually do have a lot of more information that your board has requested in there. Particularly the areas that will be prioritized required by the grant agreement. Includes 4 areas: business with less than 100 employees, business within rural areas, business that identify as minority-owned and woman-owned, service disabled, veteran-owned, and emerging small businesses, and non-profit businesses entities owned by Black, Indigenous, Asian Pacific Islanders, and all other people of color and or women or eligible nonprofit primarily serving these communities. So in addition to what's laid out in the contract language, we also recognize this additional state intent that's being these other communications, which includes the hospitality industry, businesses impacted by freeze, and businesses that identify as Black, Indigenous, people of color, and tribal-owned small businesses. So those are the areas that we're recommending your board review and approving, and then that will be the direction that the program development folks will take as the county's priority when we develop these programs. So this agenda requests your board to accept this grant and consider approving the IGA for staff to sign the IGA with the state. With that, I'd be happy to answer any of your questions.
Commissioners, do you have any questions?
No, I think the only comment is I appreciate the staff's quick work on this, and we're working under difficult circumstances, not only with all that's going on in the world, but which COVID in particular, of course, which has necessitated us doing virtual meetings, having to do new protocols, and so all we can do is the best we can, and we all look out for each other and make sure that when something gets overlooked or missed, that we just help each other out. And so I'm glad that we were able to make some additional changes that were needed, and we all just work together as a team. It's great. So I believe I'm pretty comfortable with this, but I'm certainly open to hear other concerns from our chair or commissioners. Thank you.
Commissioner Rogers?
No, I'm fine as well.
Okay, Commissioner Treese? Okay. So on November 17th, the governor announced that the state would be providing $55 million to be distributed via counties prioritized for businesses in the hospitality industry hurt by the freeze order. And at that time, the freeze was taking effect November 18th for 2 weeks through December 2nd. And now it's evolving into the extreme risk. But those businesses, right, this grant funding is made specifically to prioritize those businesses, excuse me, in the hospitality industry hurt by the freeze order, small businesses, and those Black, Native American, and other historically disadvantaged communities. So that's why I want to make sure that as we move forward, and the state has tried to effectuate the easiest, swiftest contract to get these funds distributed. And we are doing the similar action of distributing it through are known entities so that we can reduce the amount of work that's needed to get the money out to the community as quickly as possible. But it does need to be true to the state's intent. And that's one of the things that I was looking out for, that this would be a swift execution, but these dollars are not intended for backfilling or covering costs from our local jurisdictions to recover from their COVID costs. And instead, I want to make sure that our action is true to the intent of this grant. And from what I've seen, our staff, Marshall, from the November 17th information and cover for us here today is that the recommended action is true to that intent. So thank you very much for getting that taken care of in swift order. Are there any other comments? Seeing none, do we have a motion?
Move for the recommended action.
Great, so we'll take them each separately.
And second.
We have a motion from Commissioner Treese with a second from Commissioner Scouten to accept the grant and authorize intergovernmental agreement with the state of Oregon for COVID-19 business assistance. All those in favor, please vote by saying aye.
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 Any opposed? The motion carries unanimously 4-0. I think I got it right that time. Do we have a motion to authorize the intergovernmental agreements with cities and contracts with community partnering organizations for the state COVID-19 business relief grants?
So moved.
Second.
Second.
We have a motion
And third.
from Commissioner Treese, second from Commissioner Rogers. All those in favor, please vote by saying aye.
Aye.
Any
Aye.
opposed? The motion carries unanimously 4-0. Next, we have our last action item, and this is what had been item L under support services to adopt the annual investment policy. I'll just give an overview. We have an update to our investment policy. Last year, we had language to ensure that we were not investing in companies engaged in the fossil fuel industry. This year, our staff has updated the investment policy with further language for a variety of needs, but also included in that. And the articulation of it in the red line version tripped us up a little bit. So we wanted to pull that item off the consent agenda and make sure and confirm that we were all clear on what we were adopting. So that's just a little background as to why we find ourselves with this off of the consent agenda. Is there anything else that either you want, Commissioner Scouten, that Mr. Liang can provide?
No, thank you for asking, and thanks for that initial summary of why we pulled this item. I think what we're talking about specifically is item 8B, which lists some of the allowable investments, which provides specific descriptions on in the following page after that. So we're looking at page 9 of 20 and page 10 of 20 of the red line version. And there's some language in there about companies that are not listed on the fossil free index. And I think that language, I understand it, is intended to further implement our policy with respect to the kind of investments we're putting into. And unless I misunderstand the language, I'm satisfied and will be happy to support this item. Thank you.
Any other comments or questions, commissioners? Mr. Liang, was there anything else you wanted to help ensure we are clear on or amplify?
No, I think you summarized it very well. Thank you very much, Chair Harrington.
Okay. So what are the wishes of the commission with regard to this? Do we have a motion to adopt the annual investment policy?
So moved.
Second.
We have a motion from Commissioner Scouten and a second from Commissioner Treese. All those in favor, please vote by saying aye.
Aye.
Any opposed? The motion carries unanimously 4-0. Thank you, colleagues. Next, we have, thank you, Mr. Liang. Next, we have our second oral communications period. But so I want to turn it over to Clerk Moss and see, do we have Mr. Feek?
I think we do, Madam Chair. Dale, can you hear us? Dale, you're muted. Can you hear us?
Mr. Feek, can you hear us?
Sorry, Dale, we still can't hear you.
Try it again. Can you hear me now?
Yes,
there we go.
Success.
Oh, brother. All right. So Dale Feek, I actually have 3 comments at 3 different time intervals because I want to make public comment based upon the resolution for fiscal year for the Clean Water Services, but I couldn't get on. And then I had a hearing comment for the Clean Water Services ordinances, and then I have comment just generally. So I have 3 times. Which one do you want me to go first, Kevin?
Please just go ahead with any and all, and we will update the record.
Okay, take me more than 5 minutes here. So anyway, here we go. First one. I want to just say that I am supporting the resolution order for fiscal year 2021 by Clean Water Services. And that was my main comment that I was going to say for that action, okay? The second thing is the hearing on the Clean Water Services ordinances. I sent you an email early this morning about that, and I see Chair Harrington's head nodding, so she received that. I'm Dale Feek, Chair of the Washington County Citizen Action Network. I'm a chair and spokesperson for that. It's a coalition of grassroots advocates dedicated to improving the quality of life in Washington County by promoting healthy and sustainable communities, social and economic justice, open and responsive government. And in listening to your work sessions and in listening to the deliberation you have, I'm totally impressed with you, commissioners and staff, at being a responsive government. So I just want to thank all of you and what you do. So this is hearing testimony based upon the ordinances and what I sent to you. And as I said in what I wrote, I'm learning about what comments I want to make during the public hearings on that ordinance. In my preparation to make public comment, I made a public records request to Clean Water Services. Following is the reply I received with the 2 attachments. The first attachment is regarding Clean Water Services, pre-treatment compliance. The second attachment is closing meeting notes, and those notes were the ones that were taken by Bob Baumgartner during his talk with DEQ and EPA, the proposal on the ordinances. And I go to the Clean Water Services Advisory Committee regularly just as a citizen and listen and then comments there. And that's when Bob informally talked about that staff report. And so I said I'd like to get that.
Boots.
And
Come on, Boots. Come on, Boots.
Boots, okay, hi Boots. So anyway, I was told by Jerry Linder that I need to make an official public request to get that, so I did it. So then I got the official, Bob was very gracious, and he summarized that telephone conversation, and that is part of the document that you have. It's very informative, not necessarily, there are things that the Clean Water Services need to do differently, and they were told so, but in a nice, cooperative way, okay? All right. At the Intel Air Quality Advisory Committee meeting on November 19th this year, Stephanie Stanley, she's an Intel environmental engineer, I think she was also on the Clean Water Services Advisory Committee once, reported that she just emailed November 19th or sent some way a report to Clean Water Services detailing what kind of perpolyfluorinated substances Intel has to use to manufacture their products. They can't manufacture without those products, period. And here I lost where I was. I ad-libbed too much. She said she reported to Clean Water Services. I think that she said that they have had PFAS and PFOA emission discharges into the public water system, and that they're trying to use those substances in very specific places during their manufacturing processes. She also said that the new Intel wastewater treatment facility that they are building at the Ron Acres site should be able to capture most of the emission. I think that she said that they are trying to eliminate the use of PFAS and PFOA, derivatives of the per-polyfluorinated substances, with another derivative of them. Knowing which derivatives that Intel will be using is very important for Clean Water Services, so they can establish local limits on those substances, because there will still be per-polyfluorinated substances. You can't get rid of them. Last point on this is Hillsborough landfill had, I think, the highest level of PFAS, PFOA emissions in the public water pipes, as the sampling showed that Bob Baumgartner and Joy shared with me. I'm wondering how Clean Water Service will propose local limits on the landfill to protect those getting into the public pipes and the river systems. So I think that addresses some of the ordinances, and at least if it doesn't, I hope it will in time. All right, so that's my public hearing for that. Now I have, since I'm a group, well, it doesn't make a difference, I'm in the 5-minute period now. So I'd like now just to make my general comments that I was going to make during the 2-minute time. Okay, so here's that, okay? So I'm starting over for 2 minutes. Or 5 minutes now since I'm a group. I don't know how you're going to time me. So anyway, here I go. Two big topics here. One, WCCAN's decision made last night. Second topic is, so the first topic is WCCAN. Last night we had a board meeting with other people invited to that board meeting, and we unanimously approved a motion to request a 30 to 45-minute day review period for the significant natural resource habitat assessment guidelines. So that is what we are asking you to do. So that's topic one. Topic two, with climate change investments. And man, am I pleased with what you're doing in the way of actually divesting from fossil fuels. The church I used to go to, the United Church of Christ in Forest Grove, the national office, I mean, there was a proposal to divest from fossil fuels. That went all the way from local to regional to national. And so Jim Atel, he was he's retired, a Massachusetts conference minister for the United Church of Christ. And at the national convention, he got through the first ever proposal to divest from fossil fuels. It was the first church organization that did that, and few other people have started, and that was campaigned by 350.org. That was Bill McKibben that helped start that. And so this idea, divesting from fossil fuel, is right on the mark, and you are doing it. Now, related to that, I read a book called Tightrope, Americans Reach for Hope. Is written by Nicholas Kristof and Cheryl Udun, who are Pulitzer Prize winning journalists. They've won 2 prizes among themselves. It just so happens that Kristof was raised, I don't know if he's born, but he was raised in Yamhill. And this book that he wrote, Tightrope, Americans Reaching for Hope, is about homelessness. It's about everything that you said, Commissioner Rogers, about what you need to do to support people that are going through depression, suicides, all the things that can get people in trouble. It's also how people cannot bring themselves up by the bootstraps. They need good, effective, responsive government if they're going to help, as you are doing with the Latinx and other people in Washington County, and the emphasis that you're putting to help those people that cannot help themselves. So this book then was made into a documentary. I read the book, and then I finally read the documentary. And he and she list 10 things at the back of the book that you can do within 5 minutes to make a big difference. So I ended up writing him and I got a reply back, but the outcome is I went over to his farm and talked with him. I talked with his mother. He was going to be here for 2 weeks for Thanksgiving. I had a chance to talk with him, his mother, didn't talk with his wife, but I talked with him and I shared with him my reaction to his book, because I was asked by his editorial assistant, New York Times, to do that so that he would know more what I wanted to talk with him about. So I sent it to her. He hadn't really read it in detail, but I hand delivered it to him at his farm, his mother's farm, okay? And so the point of this is investments. I mean, that's the point of this. Because one of those, there are 10 things you can do very quickly to make a difference. Book clubs. Ask your book clubs to read the book. I have 2 book clubs. I'm asking them to do that. Also, you can, and you know that I'm a reading teacher, and I encourage you to use the book, Teach Your Child to Read in 100 Easy Reading Lessons. Literacy is the name of the game for people that need to get out of where they are. And then the third thing was reward companies. My wife and I are fortunate enough to have money in Vanguard. So what I told him to do, we will also ask our Vanguard person to divest from fossil fuels. So that's what you are doing. I would encourage you, all of you, to watch the movie Tightrope, Americans Reach for Hope, and read the book. Because what you are doing is what he recommends we do, and we're hoping to do a book thing on him here in Washington County. Thank you very much.
Thank you, Mr. Feek. I'm really glad that we were able to work out the public comment logistics for today. I know it can be really challenging to figure out all the technology in order to engage with us in this virtual fashion. So thank you so much for hanging in there. You know, working from home is quite different for me than working in the office. I don't have the same space or access at my fingertips for things. So I'm hoping, Ms. Angie, on one of the topics that Mr. Feek spoke to, that perhaps either later today in our work session or a quick update in our meeting next week, if we could get just a reminder from our staff on the next steps with regard to the significant natural resources habitat guidelines and the next steps on that, both at the Planning Commission and at the board. I would find that helpful. That'd be great. Thank you.
Just to echo something from the chair, yeah, it is different working in the home, and my apologies. Boots did get safely escorted outside. She would not be in the office, but she's very much a part of our home life. So my apologies to our speaker and to the rest of the board.
No need to apologize. We all have coworkers of different types and different struggles as we work to get through this. It's nice to know that you have that comfort. Thank you, Commissioner. I actually appreciate that kind of stuff myself, so it's great. Thank you again, Mr. Feek, for joining us today. Commissioners, are there any items that you'd like to highlight before I do the standard meeting announcements?
No.
No? Okay. Well, I'll just announce that we have our roundtable starting at 10 a.m. on Thursday, December 3rd. Then we have 2 more full slates of meetings set up for subsequent Tuesdays. Tuesday, December 3rd, we'll have a work session that starts in the morning and a board meeting at 10 o'clock. Then on Tuesday, December 15th, our work session will be an afternoon work session and then an evening board meeting. That will be our evening meeting for the month. It looks like we have a couple of items that we will need to attend to before the end of the year. So we have a placeholder that will be able to firm up or not but a potential placeholder for a business meeting on December 22nd. So sorry to impinge upon 2-week holidays, but our staff is working on various logistics and we'll review that at our meeting on Thursday as well. Any last questions or comments before we adjourn today's meeting? Okay, we will reconvene our work session in an hour. Is 1:15 okay versus 1:20?
Fine.
Okay, great. Well, so we will now entertain a motion to adjourn today's business meeting of December 1st, 2020.
So moved.
We have
Second.
a motion and a second through Commissioners Treese and Scouten. All those in favor, please vote by saying aye.
Aye.
Any opposed? The motion carries unanimously 4-0. I'll see you back here in a Zoom meeting, not this one, but another one at 1:15. Thank you, everyone.